This meeting is being recorded. Okay, I think we're going to go ahead and get started now that it's 6 o'clock. Welcome, everyone. My name is Amy. I am a registered nurse. I've worked with Dr. Fox for a little over 13 years. I'm going to be moderating the chat tonight, and I'll be available to answer some of your questions on the chat, and I'll also be fielding some of your questions to Dr. Fox during the live Q&A at the end. So don't hesitate to hop on there and toss your questions out. A quick disclaimer before we start. Excuse me, that the medical information contained in this webinar is for informational purposes only. Although the instructor of this webinar, Terry Fox, MD, is a licensed physician, she is not your physician solely by virtue of registering for or attending this webinar. The information and content provided in this webinar is for informational and educational purposes only and does not constitute medical advice. By registering for the webinar, you hereby acknowledge that Terry Fox, MD, is not engaged in the practice of medicine by teaching this webinar, and you agree and acknowledge that no patient-physician relationship is established solely by virtue of taking this webinar. Due to the absence of any kind of patient-physician relationship, no communications exchanged during the course of this webinar shall be protected by the patient-physician privilege, and Dr. Fox owes no duty of confidentiality to the webinar attendees. The content contained in this webinar is not intended to replace medical advice and/or care. The information presented in this course is not to be used as a medical treatment program and is not intended to be a substitute for professional medical training, advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding the medical condition. Never disregard professional medical advice or delay in seeking it because of information you obtained or something you have learned during this course. Terry Fox, MD, her employees, instructors, officers, directors, and assigns hereby disclaim any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the content provided in this webinar, which is provided as is and without warranties. Okay, so now that we're through that, I'll introduce you to your host, Dr. Terry Fox. She went to the University of California, San Francisco Medical School and holds a board certification in integrative and holistic medicine. She's trained in functional medicine, which she's been practicing for over 27 years. Her practices now focuses on biotoxin illness, mold toxicity, and Lyme disease. She's a founding member of ICI, a founding physician for Ravel, and is on the medical advisory panel for Change the Air Foundation. Her life is committed to helping people with mold illness and Lyme disease. So here she is to talk to you about mold toxicity and her mold eradication protocol. Terry?
Hi, I am so excited to be here tonight with all of you. Welcome, come on in. So I'm going to speak tonight about three things. One, about mold illness and what it looks like, and some key strategies for treating it effectively. And two, some common pitfalls that people tend to do when they try to treat themselves and they're unsuccessful or they make themselves more sick. And three, I'm going to share with you something that I created that I'm really excited to bring to the world. And it's a live masterclass for mold treatment for patients that I'm going to be starting it immediately, right? This weekend. And so this masterclass for you is for you if you have mold and you don't know how to treat it. You have mold and you've tried to treat it and failed or made yourself more sick. You have mold and Lyme and you don't know how to treat the mold piece. Or you think that mold might be at the root cause of your illness, but you're not sure where to start. So while treating patients with functional medicine, over 24 years ago when I first started, I found that most of my patients got better with the sort of usual functional medicine matrix where you heal the adrenals, you work on the sleep, you clean up the GI tract, you do some nutrient optimization and hormones, and about 20% of my patients just wouldn't budge no matter what I did. I couldn't get them better. And what I came to find out over time was that most of these patients had biotoxin illness, which is mold disease, Lyme co-infections. A biotoxin is something that a living organism releases that is pathogenic or disease causing to humans. And so once I figured this out, I started doing a lot of Lyme disease. And then I started doing mold because I realized that mold is often the reason that Lyme remains chronic. I've had several large and nasty, awful mold exposures myself. I know how bad it can be. And I also know as a MD and a physician treating mold that mold is completely treatable with the right framework. And I'm here tonight to share that with you. So at the end of the webinar, we're going to give away a free scholarship. So somebody will get the master class for free, and we're going to announce it at the very end. And the first 5 people to register for the master class will get a complimentary one-on-one phone call with me. And I would encourage you to keep that phone call for a time in the protocol where maybe you feel, it's a little tricky, or you feel stuck, or you're not sure what to do about something. And so here's the link to register for the course. So registration is open now. Amy, if you could drop that link into the chat, then people can copy and paste it into their browser to have a peek at it. It does have our e-store that has all the things that you would need to treat mold with a discount for everybody in the masterclass, and it has a replay of the webinar, and that's where you would register for the course. So, what you will come to learn in the next 45 minutes is that many doctors don't know how to accurately treat or diagnose mold toxicity. And that is because we learn nothing about mold in medical school, nothing in medical school or residency. I learned that it was in the a fungus. That was all that I learned. And so the truth is they really just don't know what they don't know. They don't have any information about mold. But what I'll introduce to you tonight is my two-step mold eradication protocol that's worked for thousands of patients. So some common mold symptoms, if you're wondering if this is you, fatigue, brain fog, which means cognitive dysfunction of all kinds. So memory loss, word recall, difficulty with focus concentration. It has a variety of neurological presentations that don't fit into any normal neurological diagnosis. So numbness, tingling, weakness, burning, ice pick sensations, vibrations, and particularly when they move around, they're not even in the same place. And then there's often a rapid, inexplainable weight gain or weight loss. I see a lot of acne. I see a lot of hair loss. I see a lot of frequency of urination. We see a lot of hives and, MCAS, POTS, hypermobility. There's a lot of common comorbidities that come with mold toxicity. So it has been estimated that 70% of homes in the US have toxic mold, and about 45 million buildings have toxic levels of mold, unhealthy levels. And about 93% of people with chronic sinusitis, it is now attributed to a fungal origin. So most patients, before they come to me, have seen 20 to 40 doctors. They've seen all the specialists. They've gone to rheumatologists, they've gone to neurologists, they've seen orthopedists, they've seen their internal medicine docs, they've had scans, they've had MRIs, they've had CAT scans, they've had EEGs, you name it. Many of them have even gone to the Mayo Clinic. And what happens is they get told over and over that there's nothing wrong with them. In fact, sometimes they tell them that it's in their head. And the truth is nobody, when you go to all these specialists, nobody's looking at the whole picture. So each specialist has their own lens that they look at a patient through. So a rheumatologist has a variety of rheumatological diagnoses. And if you don't fit into any of those with your constellation of symptoms, then they say there's nothing wrong with you, or I can't help you, is what I wish they would say. And likely nobody in the regular Western medical establishment has tested you for mold. And if they did, they might not know how to interpret the results or how to treat it. So, after seeing many specialists and being told over and over that there's nothing wrong with you, you may begin to feel that you are crazy. And I'm here to tell you, as an MD and as a very, very sensitive mold patient, and as a mother, that mold is real and it's treatable, and you are not crazy. The Western medical establishment just doesn't yet know about mold illness. It's not that they don't want to help you, it's just that they don't know what they don't know. So now I'm going to share with you guys why this has become sort of my life's work and my divine path in the world, treating mold illness. Um, and why I created this live masterclass after treating patients for 12 years with mold and figuring out what works and what doesn't. I've created this very curated mold eradication protocol that's worked for thousands of patients. So, what happened to me was when my son was 13 years old, at that time I was treating quite a bit of Lyme in clinic. And my son, his name is Kai, and he was one of those fearless, thrill seeking, maniac little boys that was too busy to eat, that was climbing up things, jumping off, trying to jump off bridges into creeks. And it appeared to me he was just trying to kill himself for the first 4 years of his life. I couldn't help think like, where is your survival instinct? But there's many little boys like this. And I just pointed out to sort of show you how odd it was that he began limping. So he was 8 years old. It was 2013. He began limping. And I would ask him, I would say, Kai, do your knees hurt? What's going on? And he would then stop limping. He would walk down the stairs sideways, holding on to the rail. And I would look at him and I go, Kai, does something hurt? Like, what are you doing? And he would just turn forward and walk down normal. But when he thought nobody was looking, he was limping off and on. And I knew this wasn't normal. And I knew that something was off. Um, and so I began testing him for things. So this picture is of him holding a soccer ball before, I don't even know, this might even be before he fell in love with soccer. His two favorite things in the whole world were soccer and Legos, like many little boys that we probably all know. And after he began limping, he started getting stiff. So, for example, we would go on a road trip to go camping, and when he got out of the car, he would be really stiff. Or in the mornings, when he first woke up, he would be really stiff. And he started getting anxiety out of nowhere. This fearless little kid started just having panic attacks and getting super anxious. He got sick a lot, really, really sick. I mean, 8-year-old boys get sick a lot, but this was worse than the normal sickness. And then he also started putting on weight. It was really strange. He was this scrappy, underweight little child, and he began putting on, he put on 35 pounds in about 6 weeks. He started off at, I think, 60 pounds. Um, so eventually I tested him for Lyme disease, and it was positive. And at that point, I knew he had Lyme. And at the same time, what happened was I noticed a musty smell in his room. And so I had a mold inspector out, a mold inspector, who said there was a water leak in the attic above Kai's room. So we were getting ready to leave on a 2-week trip to Vietnam with all of our extended families. My kids are a quarter Vietnamese. And so what I did was I hired a local sweet family run construction company to come and fix the water leak above Kai's room. Now, for those of you who know a little bit about mold, you can imagine I knew nothing about mold. I knew nothing about containment. I knew nothing about negative air pressure. I knew nothing about remediation. I would have never, ever let a normal construction company that didn't know anything about mold, that was not a professional remediation company, come and remove any wet materials or fix the water leak if I had known then what I know now. So we got back from Vietnam and Kai's system crashed. He didn't get out of bed for the next 6 months. He dropped out of third grade, and more importantly and sadly for him, he couldn't finish out his soccer season. He was in 9 out of 10 pain in his head. It got worse with any movement at all. So this crazy busy kid could not move without excruciating pain. Um, so one of the blessings was that he could still work on his Legos a little bit before it would exacerbate his head pain. And he had these really sweet childhood friends that are still his friends that would come over and play board games and chess and kendama. And I could see them like just antsy and, 8-year-old, 9-year-old little boys all busy. And they were just so sweet to sit there with Kai and keep him company and do things like that. So at this time, I was also mold sick. I was beside myself. It was excruciatingly painful to watch my son be in 9 out of 10 pain and not be able to help him. I had intense anxiety that I had never had before. I could not sleep at all. I had almost daily migraines, and I really just couldn't stop searching for answers for my son. I lost 15 pounds that I didn't need to lose. So my son gained 35 pounds on his 60-pound little body, and I lost 15 within the space of 6 to 8 weeks. For me, this is a big clue of mold when I get this from a patient. I brought Kai to see all the specialists, and I brought him to headache clinics, and I brought him to the emergency room on multiple occasions. We had an inpatient stay at Children's Hospital that was incredibly traumatic. And then I brought him to some great Lyme docs that helped a lot. And then eventually I flew him out to California to see Dr. Stephen Harris, who started him on some antibiotics for Lyme and Bartonella. And he gave us a real-time labs mycotoxin test. So we brought it home and we tested Kai, and his mycotoxins, which are toxins that mold releases, were through the roof. So at this stage, I knew, okay, there's more to this story. There's more to the picture. And I knew enough people to ask what to do next. And so at that stage, I got a good IEP, or indoor environmental professional, out to the house who did a full, complete evaluation of the home and found 3 feet of water in the crawl space under our entire house. So we had one of those crawl spaces that went under the whole house, and some parts it's small, some parts you could stand up in it, and the whole thing was full of 3 feet of water. Our airborne spore traps were in the red, which I will just tell you, don't even do an airborne spore trap because they're notoriously low yield. You never catch it on an airborne spore trap. But that will just kind of show you like how significant and horrible the mold was. So this was 2014, and in 2013 was the year of the Boulder flood, and our whole block had flooded. We had one of those fun blocks that they all had kids the same age. They all went out and played every day. Everybody's house flooded. I thought that our house had come out okay until we got the good indoor environmental professional out and realized that, obviously we had not come out okay. So again, if I'd known then what I know now, I would have never, ever let a regular construction company come in and take out anything from the attic. So what happens when you disturb mold? So imagine, this construction company goes into the attic above Kai's room, and they fix the water leak, and they pull out any wet, moldy drywall. And as soon as you disturb mold, it releases, I don't know how many times more, but a lot of times more mycotoxins, the toxins that make us sick. And so you disturb it, it goes, releases all these nanoparticles, all these mycotoxins, and then you carry this wet, moldy material through my son's room and then through the rest of the house. That's what happened when we were in Vietnam, and that is why Kai's system utterly, totally crashed when we got back. So what we did was we remediated the house, which was no small feat because it was a massive issue. And we moved out. My marriage didn't make it out of this, unfortunately. But when I got Kai into a clean home, He did great. So we started him on, so I forgot to mention, but for those 3 months that we were still in the house and well, partially in the house, after we'd seen Dr. Harris, he was on phase one of mold treatment as soon as we got the mycotoxin results. So he was doing binders and all the other detoxification support for a solid 3 months. And then when I got him out of the exposure and I started him on phase two, kill or be killed mold detox, his headache went away, his migraine went away, and he slowly got stronger and healthier and stronger and healthier until, he sort of started back at school a few days a week. And then within 3 months, he was back at school full time and playing soccer 6 days a week. He actually was practicing with two different teams because he wanted to get better than he had ever been. He was so upset that he'd missed that much time in his life. Um, and he has remained completely healthy and he's playing competitive soccer, snowboarding. And now he is in college. This is when he moved into college. He's studying engineering. He's happy and healthy, and he's still close with his sweet childhood friends. And I actually have seen all three of them again this summer coming home from college, which was lovely. I love those kids for being there with him that whole time. And so this whole experience changed our family forever. Even as a physician, watching my kid go through mold toxicity was insanely painful and heartbreaking. And I'm here tonight because I've been through it and it's awful. And out of practicing mold, practicing medicine, treating mold mostly for 12 years, I have learned all the things that work and all the things that don't. And so out of that, I have curated a mold eradication protocol that I'm bringing to you guys tonight that has worked for thousands of patients. I personally believe that mold is really treatable with the right framework. So, if you have been treated for mold and were unsuccessful, well, the chances are you can still heal. And if you tried like one binder or one treatment, one antifungal, and you felt worse or it didn't work, that doesn't mean that you can't heal from mold. There's a very methodical and specific order to how we treat mold in order to be successful and get your life back. So, my mold eradication protocol is 2 steps. So, phase one, I call bind and unwind, and phase two is called kill or be killed. And so, phase one is where this is a really critical step, and it's one of the things that I think a lot of people do when they try to treat mold themselves, or they've tried to treat their mold and they failed or been unsuccessful or gotten more sick. I think a lot of those didn't do phase one or they didn't do it adequately or for long enough. So in phase one, what we do is we train the body how to detoxify or metabolize or pull out, get out of the body mycotoxins. And some mycotoxins are neurotoxins, which means they attack your central nervous system and your peripheral nerves. And so by the end of phase one, you are successfully detoxing and metabolizing and pulling out mycotoxins, effectively decreasing your total body load of mycotoxins before we start killing any colonized mold in the system with antifungals or opening up biofilm. And that way we're successful because the body has now learned how to pull these out. And this phase lasts as long as it needs to. And this is something I'll walk you through step by step. It's pretty spoon fed in my master class. So I want to share a story of one of my patients. Her name is Kathy. She came to me when she was 35 years old. She's a chemical engineer. She's an avid hiker. She was hiking 14ers all over Colorado. She wanted to start a family. What happened about 2 years before she came to me was she started having these flares, these episodic flares, where she would suddenly get so foggy, brain foggy, that she couldn't think. She'd get dizzy, she'd get a headache, and then she would get exhausted and weak to the point of being unable to move her limbs or hold her body up in space sitting. She couldn't verbalize. She would slur her words. Now, this flare would culminate in her falling asleep for 16 hours, wherever she was. Her husband found her once on the kitchen floor one morning. These flares were triggered by doing too much of a variety of things. So, too much screen time would do this. It could trigger a flare for her. Too much exertion, too big of a hike, too much work. And before she came to me, the amount that she could do before a flare was getting smaller and smaller and smaller. So she had seen over 14 doctors before she came to me, all the specialists. She'd had multiple head scans until a neurologist finally said to her, "You have basilar migraines," which I really don't think is a thing. And so they gave her migraine meds, which didn't work, and they sent her on her way. And so I want to just also ask you guys, everybody here, if you think you've been misdiagnosed, can you just write that word misdiagnosed into the chat for me? So I tested her for mold. Her mycotoxin levels were really high. She also had, excuse me, um, a high environmental toxin load, which we discovered was an exposure she had as a chemical engineer at work. And so I started her on phase one mold treatment. She had to work her way up pretty slowly on binders, or she could trigger a flare. And then once she got up to full doses of binders, which took a couple of months, what happened was that the flares didn't go away at that stage, but she had a lot more capacity or resiliency before she would get a flare. So for example, maybe she could do 1 hour of screen time and now she could do two or three. She could do a walk. Now she could do a 1 hour hike. So her capacity of resiliency improved in phase one. And then when we started phase two, she also had to work up slowly or it would trigger a flare. But she, got up to full doses after a month or so. And in about 6 months, she was better. She had lost 25 pounds. She was hiking mountains in Colorado that she never thought that she could before. And she's now wants to start a family. And so, like so many of the people that come to me, she just had the wrong diagnosis. And, it was by a doctor that doesn't know about mold. And so, without the accurate diagnosis, there's no way for you to know how to treat it. So, I'm so happy that she came to me. She's still my patient. I adore her. And, I just don't know exactly what would have happened to her if she hadn't gotten the accurate diagnosis and been proactive about her treatment. I imagine those mycotoxins and neurotoxins would have just gotten deeper into her nervous system. And she was already, having less and less bandwidth before a flare would happen. And so I'm just so glad that she's better and having a happy and healthy life now. So I want all of you here tonight to know that you're not alone. I have seen hundreds, thousands of complex chronic illness patients who have seen over 30 doctors and have no answers. In fact, I want to point out that you're here tonight with hundreds of people who may have a shared experience with you. So, in my opinion, mold is completely treatable with the right framework. You can get better. Your body is capable. I can show you the framework that I have used that has worked for thousands. So, the hardest part of mold as a diagnosis is getting out of the exposure. And so, once you're in a clean home, I really love mold as a diagnosis because patients get better. They do really well. And they get better relatively quickly, I guess, if you're comparing it to Lyme. So my framework is methodical, it's effective. There's a very specific order and pace to things so that you don't make yourself more sick. And it's a step-by-step process that I will basically hold your hand through and walk you through in the live masterclass. Most people start feeling better like each week of the protocol. So, what I often see is people will try one binder or one mold treatment. They'll feel worse or they don't get better and they give up. And this is often because they skip that first step or they don't do it adequately. The whole teaching your body how to detoxify, metabolize, and get these things out of the body. So again, I'll just say that that phase is really, really critical, and you do it for as long as you need to. And that I will explain in the live master course as well. It'll become really clear. So there are a number of conditions that are associated with mold illness. Mold is a complete attack on your immune system. So, in the presence of mold, you can get reactivation of chronic or dormant old infections. So, some examples of this are Epstein Barr virus, shingles, more recurrent or more frequent herpetic outbreaks, that kind of thing. And then the biggest example is in Lyme disease. So, in my opinion, Lyme is the number one reason that patients can't get better from chronic Lyme disease. It is nearly impossible to clear Lyme in the presence of mold. So, I can't say it enough. If you have Lyme disease, test for mold, treat the mold first instead of just herxing for years. So, for those of you here tonight who have Lyme disease, can you write the word Lyme into the chat just so I have a sense of how many of you that is? Um, so if you're the only person in a house or a building that is sick, um, this is really common. This does not mean that it can't be your house. And that's because only 25% of the population is sensitive to mold. This can be, fairly confusing and put quite a bit of strain on families and relationships because if there's only one person in the house that's sick, how could it possibly be the house? So you can understand how that's really weird to wrap your head around. But I'm here to tell you that it's almost always that way. It's almost always only one person or two people. So for Kai and I, it was both of us, but his father and his brother were 100% fine the whole time. Um, and so I'm here to tell you that it is often just one or two people. So that does not at all mean that it's not the home or the building. And these people that do get sick are your highly sensitive people. They're your canaries that are here to tell you that your indoor air quality is sick and toxic. So, another, I call it an associated condition. But so if you have multiple trash can diagnoses, I would also encourage you to test for mold, especially if you have more than one. So I will explain what I mean by this. So trash can diagnoses are basically when we have no idea, or the Western medical establishment has no idea what the actual cause of your symptom is or how to treat it, but it comes up a lot and there's a particular pattern to it and they don't know what to do about it. So they create a label or a name. So for example, you're tired, you're fatigued, all the time. Nothing seems to help. You've seen multiple specialists, nobody can help you. And so, what do? We call it chronic fatigue syndrome, and we send you on your way. Sorry, we can't help you. You have chronic fatigue, which means absolutely nothing. There's absolutely 100% a cause of every chronic fatigue syndrome patient. There's an etiology and a cause. Another example I love is irritable bowel. So, that means that your GI tract is unhappy. It's irritable. You're having diarrhea, constipation, gas, bloating, nausea, hiccups, you name it. And you've had a colonoscopy, you've had an endoscopy, you've seen the gastroenterologist. They can't find anything wrong. And so they decided they'll call it irritable bowel syndrome, which means we don't know what it is and we don't know how to help you. Go ahead and be on your way. And so some of the other trash can diagnoses are things like fibromyalgia, mixed connective tissue disorders, unspecified autoimmune disorders. All of these things have an actual cause. And if you've got more than one of these, mold isn't always a cause, but it is a common cause of some of these. I would, encourage you to test for mold if you've got two. So if this is you and you have a trash can diagnosis, can you put the word trash can into the chat for me? Thank you. So if you or your child has acute onset anxiety, depression, OCD, intrusive thoughts, ruminations, severe insomnia, MCAS, or PANS. I encourage you to test for mold, especially in children. It often presents with neuropsychiatric or mental health issues, and it's often sort of comes on sort of acutely. So PANS, what I mentioned is pediatric acute onset neuropsychiatric syndrome. So there's PANS and PANDAS. PANDAS is from strep. So PANS is usually from mold, Lyme co-infections, or other untreated infectious triggers. And basically what it is it's an encephalitis, meaning your brain is inflamed, and it's autoimmune. So you've created antibodies to your own neurotransmitter receptors. And what this does is creates a variety of neuropsychiatric symptoms like OCD, like anxiety, like tics, sensory integration, that sort of thing. It's a pretty brutal and awful diagnosis. So if your, child or you has autoimmune encephalitis and it's not from strep, I would encourage you also to test for mold and see if that is the infectious trigger. So MCAS, mold and yeast are very common triggers of MCAS. So MCAS is mast cell activation syndrome. And a quick version of what this means is so your mast cells house your histamine and a lot of other inflammatory intermediaries. And so what can happen is you can get like after often after eating, but not always, but you can get a full like body like dump of histamine from your mast cells. Your mast cells just all degranulate, not all, but most of them or a lot of them at the same time. And this creates flushing and swelling and hives and sometimes brain fog, sometimes tachycardia or an elevated heart rate. Mold and yeast are real common triggers of MCAS. So if that's you, I encourage you to test for mold as well. So if you're secretly afraid that you're not going to get better, I want you to know really mold is treatable. It's absolutely treatable with the right framework. I've had thousands of patients who thought that they would never get better and are now living healthy, happy lives after effectively treating and eradicating their mold. If you're sensitive to everything, you can still treat your mold. You'll have to go really slowly and gently, and I will guide you through that explicitly in the live class. But you can get better. You just have to be patient with yourself, which can be hard for some people. Um, and if you're afraid you're crazy, I'm here to tell you again that you are not. So I want to talk a little bit about some of the common pitfalls that I see that people do before they come to me, where they're either unsuccessful or they make themselves more sick. And the way I'm going to do that is by explaining a couple of key concepts in mold illness. So there's a lot of misinformation, misguided, incomplete information on the internet or with Dr. Google about mold. And so this sort of incomplete information can lead to people trying things without actually knowing what they're doing, and they end up making themselves more sick. And so I'm going to try and give an example. This is how I try to explain it to my patients. So imagine you're in phase one and you're on all the right binders for your unique mycotoxin load. You've got drainage support for all your detoxification channels. You've got everything that you need on board to detoxify and metabolize and pull out mycotoxins. And so let's say, you've got all these things on board and you've got your binders. You've worked your way up to full dose. You feel better or neutral. You don't feel worse. I don't ever feel worse in this protocol. And so you're binding these mycotoxins and you're pulling them out in the stool consistently for 3 or 4 weeks. What happens after that is that the rest of the cells in your body get the signal that there's a way out for these toxins. And so these mycotoxins and neurotoxins are toxic to the cells. They want to get rid of them. So as soon as they sense there's a way out, they'll start dumping. And if they dump more than your body can get out in the urine, the stool, and the sweat, you will feel worse. And what it's doing is it's mobilizing stuff to different places, which might be a worse place than where it started. And it is not getting you anywhere. And so you have to respect your own boundary of what your body can detox in each moment of time. And that's one of the most critical concepts in mold. So if you go too fast, you just flood your system with more of the very same thing that was making you sick in the first place. So another concept that I want to explain that can help people understand why the protocol is how it is. So total body burden. I imagine many of you have heard of this concept, but imagine that you have a bucket in your body that you've had since birth, and it gets filled up with toxins and infectious biotoxins. And so you get born and you get born, you're born and you start getting exposure. So you get plastics, pesticides, glyphosate, and then maybe you had Lyme and you've got and Bartonella and Babesia and you've got biotoxins. And then maybe you had a couple COVIDs with an intense inflammatory reaction. And then you get in a moldy house and boom, your bucket overflows. And when that happens, the system crashes. And so you can begin pulling out any of those things and lower your total body burden and begin to be able to tolerate the world and feel better. So, the common things that I see and pitfalls of people doing things where they're unsuccessful is trying to detox too fast. So, going from 0 to 100 with binders, using the wrong binders for your unique mycotoxin load because maybe you didn't get a urinary mycotoxin test, which tells you which strains you have. Starting antifungals, herbal or pharmaceutical, biofilm agents too soon in the process, therefore flooding the system with more of what's already making you sick. Staying in a moldy house. Now, you can begin to treat your mold in a moldy house. You can start, so you imagine you're being exposed and that, it just keeps increasing. So you can begin decreasing your total body burden while you're still in the exposure. You're not going to likely get 100% better though. So that's, one of the hardest parts of mold is that you do have to get into a safe, non-moldy space. And then another thing that I see is, an inadequate remediation, which is just one of the saddest things to watch. I mean, I make my patients go to very particular people for their remediation, but sometimes people come to me and they had a remediation, and there's a lot of people out there that call themselves remediators that don't really know what they're doing, and so you can have a bad remediation or inadequate remediation where they don't do very much, and then you may even feel more sick as opposed to not better. You can sort of think of the example with my son Kai, where if you didn't set up a proper containment and negative air pressure, you can actually make the whole thing worse. So, what I tell my patients is if you can't afford to get the right remediation company out there, just leave it. Don't move it. Don't touch it. And if anybody's going to wipe, anything down with hydrogen peroxide, it's not going to be the mold sensitive person because it will release more mycotoxins. And then inaccurate testing is another common thing that I see. So, if you've ever thought that the Western medical community doesn't know how to help you, you're probably right. But we're here to help you get past the mold. And by we, I mean me and my team, which is Amy and Aaron and Derek. You might have had some interactions with some of them already. And we're all here to help you put the mold behind you so that you can get your life back. So with my mold eradication protocol, my commitment and my hope is that you heal completely. You get to go out and run marathons and be the best parents and the happiest kids ever while feeling great. Um, let's get the mold past you and you can get back to your dreams and your life. So, my goal in the next 20 minutes is to show you how my mold eradication protocol is different, it's effective, it's unique, and it's complete. So, how do we do this? So, it's a step-by-step process that I will walk you through really clearly in the live masterclass. But the first thing that, first things first, we need accurate testing. We need tests that are going to help us. So many people get mold tests or biomarkers that might make mold suspicious, but they're not always accurate and they're definitely not helpful in deciding on your treatment. So it turns out that there's different binders for different strains of mold. And so if you go out and you just take some activated charcoal and you don't have trichothecenes, but you have ochratoxin A, it's not going to help you at all. You need to know exactly what strains you're dealing with in order to know what treatments will work. So I want to share with you another story of a patient that I had. I still have her, named Lucy. So she was 67 years old when she came to me. She is a retired accountant, an avid hiker. She loved to play pickleball. She had grandchildren that she loved to spend time with. And she suddenly developed a foot drop. And so, for those of you who don't know what that means, it's basically you can't hold your foot up, which makes it really hard to walk or go upstairs. And then she got these unusual bouts of anger and depression that she had never experienced before. And then her lower extremities from the knees down went numb and then they got weak. Not entirely weak, like she could still walk, but very weak. She went to, I don't know, 30 doctors. She went to rheumatologists and orthopedists and neurologists and internal medicine docs. She had all kinds of scans. And eventually, a rheumatologist told her that she had a rare autoimmune disorder. Does that sound familiar at all? I think that's called a trash can diagnosis. Um, so she probably would have just lived with it, except that her daughter-in-law told her she had to come see me. She's a close friend of mine and also had mold toxicity herself. Um, So she came to me, we tested her for mold. Her levels were high. And so, at least at this point, she had the accurate diagnosis and she knows what's the cause or etiology. And I led her through the treatment. So she responded pretty quickly. She was pretty hardy and healthy before this happened. On phase one, her foot drop went away, her anger and depression resolved. And then on phase two, it took about 3 months or so after we started phase 2, so it might have been 4 months or so in, her symptoms completely resolved, and the fun part was she told me that she had more mental clarity and more energy than she ever had in her life, which is pretty cool at 67 years old. Um, so if she didn't know that she had mold illness and she hadn't been proactive about treating it, who knows how her neurologic symptoms would have progressed. But now she's a badass pickle player. She's hiking mountains and spending lots of time with her grandkids. So, Lucy and Kathy and my son Kai's treatment was effective for two reasons. One, they had the accurate diagnosis. Two, they prepared and trained their body in phase one how to detox and metabolize toxins for as long as it needed to do, as long as they needed to, to where they're doing it successfully. They both did this first in a very holistic and complete way. It's key. This step, I can't tell you how critical it is. And it's why many people fail or don't get all the way better. So phase one mold treatment is bind and unwind. This is where we train and teach the body how to detoxify and metabolize and pull out these toxins. And it's preparing our body for phase two. So in phase two, which is kill or be killed, we kill any mold living in the system, which releases more mycotoxins. And so if you're not effectively doing phase one with binders catching all these mycotoxins, you just make yourself more sick. So it has to be done in like the right order. So again, if you skip this step or you go too fast, you can make yourself significantly more sick. The order of operations is critical. So the right thing at the wrong time can really, mess things up for people. So I'm going to share with you another story of a patient. This one is a little bit wild. So his name is David. He came to me when he was 46, and he was having migratory neuropathies. And what that means, migratory just means that they move around. And his neuropathies presented like numbness, tingling, weakness, burning, ice pick sensations, vibrations, and they would move around his whole body. When he had an exposure to mold, so for example, he went into a movie theater, the symptom he would get was he felt like there was water running down the backs of his legs. I tell you, the mold symptoms are endless and crazy. He also got acute onset anxiety, depression, OCD, ruminations, intrusive thoughts, severe insomnia. He had never had any of these symptoms before. He's 46 years old. And he kept telling me, this is not me. I'm not an anxious person. Like these thoughts, like I can't control them. This has never happened to me before. Um, and so before he came to me, he knew he had a big mold exposure and he suspected that this was the causative agent. And so he went on Dr. Google and he looked up some stuff and he found cholestyramine. And so he got a hold of some cholestyramine and he went from 0 to 100 and he started at 4 packets a day. He did this for a little while until he made himself so sick that he was bedridden, debilitated, and utterly suicidal before coming to me. By going too fast on the binders, going from 0 to 100, he effectively flooded his system with 10 times more of the very same thing that was already making him sick. So he came to me, we tested him. His levels were really high. We started him on phase one, mold detox, bind and unwind. And he got a little bit better. He had to kind of work his way up gradually. He did pretty good. His neuropsych symptoms softened, and the neuropathies got less frequent and less severe. And then we started him on phase two. And he told me he felt like himself again. And he was just shocked that something like mold or Lyme or some kind of biotoxic could create mental health issues that could absolutely vanish with treatment. I mean, he was just completely blown away. Um, and again, so if he didn't have, the right diagnosis or the right framework, who knows, where he would be or what would have happened. But he's now traveling the world with his family and friends, and he's doing really great. So with my two-step mold eradication protocol, David got both his mental health and his physical health back. So you can begin to see like how important the accurate testing is, the individualized treatment, and the phase one for as long as we need to. He was successful this time because he did phase one with the right binders for 3 months, and he worked his way up slowly before he started phase two. So the people that get sick from mold, they're the ones that can't metabolize it. They can't detoxify it. They can't get it out of the body on their own. There's genetic factors, there's total body burden factors, there's things we have no idea about still. And when these toxins and these mycotoxins continue to build up in your system, your bucket will overflow and your system will crash. And again, like I've said several times, do not suffer through going too fast. It will not get you there any quicker. You will just make yourself more sick. When you're doing a mold eradication protocol or a mold protocol correctly, you never feel worse. You always feel better or neutral. And whenever you feel worse, that's your sign to back off. So David is the perfect example of going too much too fast, right? So he just went from 0 to 4 packets of cholestyramine a day. Cholestyramine is a very powerful binder. And, I usually have people start with a sprinkle or a quarter of a packet. Okay, so now we get to talk about phase two, kill or be killed. This is a really fun part of the protocol. I will say again that it's critical that you're doing phase one successfully, adequately for long enough before you start phase two. And that again, I will walk you step by step. You'll know exactly when it's the right time to start phase two. It won't be a big mystery in the live masterclass. But phase two is where I often see a really dramatic clinical turnaround. This is where the needle moves. Um, and so, as long as there's any mold living in your system or colonize, so theoretically, mold can colonize in your upper respiratory tract or your GI tract. It's most commonly colonized in the sinuses. So as long as there's any mold living in your system, it's still releasing mycotoxins constantly. And so if you stay on phase one forever and you never do phase two, kill or be killed, which is antifungals or biofilm, you also won't get all the way well because you'll decrease that total body burden, you'll pull out some of your mycotoxin load, but the source is now still in your body. And so eventually you have to kill the mold in order to get completely better. This is another place where I see people relapse or they get partially better, not all the way better. And that's because they never did this phase, the antifungals and biofilm part. So mold is on the planet. Its purpose is to decompose, digest, or turn over organic matter so that you can turn a dead flower into beautiful soil for a new flower to come. So if you don't want mold to try to digest and turn over your own living organism from the inside out, then you have to kill or be killed eventually. And again, phase one has to be mastered and completed before you can move on to phase two. So all of your detox channels are open, you've got drainage on board, you're sweating regularly, you're having daily movements on, full doses of binders, all these things are in place. And so this protocol is really about timing is everything. So there's a specific order to things. So an example would be is if you took a frozen chicken out of your freezer and you tried to just cook it, it's probably not going to turn out that well. Or if you dress your salad at the very beginning of your meal prep and you haven't put the main dish entree into the oven, your salad is going to be soggy. So it's just sort of like that. The timing is really critical. So there's another analogy I like to use. So imagine that you're in a boat, and the boat has a hole in it. And the obviously water is coming in through the hole. So the water are mycotoxins, and the hole in the boat is mold living in your system or colonized mold. So you can bucket the water out and keep afloat for a while. But if you don't eventually patch up that hole or kill any colonized mold in the system, this is a losing battle. You'll never get completely well. The mold must be completely eradicated. So imagine some of you are thinking that this has worked for other people. Sure. How do I know it's going to work for me? Well, the framework is very methodical, and it's step by step. So the first thing is getting accurate testing, which we've talked about. In the masterclass, I'll walk you through exactly what testing to do and what provocations and all of that. And then if you are, in fact, diagnosed with mold toxicity, my mold eradication protocol will teach you how to effectively, gently, and methodically treat and eradicate the mold from your system so that you can get your life back completely. It's worked for thousands of people, even those who had failed before and even those who are very sensitive. And now you may be in a place where you can barely work or you're unable to work. Your marriage may be suffering because of your illness. You might feel guilty that you can't fully take care of your kids. You might have debilitating migraines or other pain syndromes. You might feel too exhausted to get through your day. You may not be able to exercise or do any of the things that you love that bring you balance and joy. and you may feel as though your life is falling apart. And the worst part of all this is that you may begin to think that you are crazy because nobody can figure out why you're so sick. And what begins to happen is this: you begin to believe that this is it, that there's nothing you can do, that there is no hope, and you give up completely. Now, my hope tonight is that you haven't given up hope, and that's why you're here tonight with me. And what I want you to know is that mold is completely treatable with the right framework. Your body knows how to heal. It's ready. You just didn't know what you didn't know. And now you do. And now maybe it's time for you. So here's how I know you're ready. You've seen many doctors who have told you that you're fine. You're desperate for an answer and a way to get better. You love your life and you want it back. So now I get to share with you what my mold eradication protocol live masterclass looks like. So for those of you who are ready and know that it's time to get at the root cause of your symptoms, I invite you to join me in this masterclass where I can walk you through this protocol that has worked for thousands. So this is for you. This master class is for you if you know you have mold and you don't know how to treat it. You've tried to treat your mold and you failed. You have Lyme and mold and you don't know how to handle the mold part. Or you think that mold might be at the root cause of your symptoms, but you don't know where to start. My hope is that some of you here tonight are feeling hopeful again. And after everything that you've been through, after being told over and over that there's nothing wrong with you and that it's in your head, after all the medical trauma, I hope that at least you all know now that mold is real and treatable and it's not in your head. And at the very least, I hope that you all know that you're not alone. And I'll remind you that you're here tonight with hundreds of other people that likely have a shared experience. So I want to do a quick little exercise with you. I want you to imagine what your life would look like in 6 months if you decided to start treating your mold illness today. So if you would, for me, close your eyes. So imagine yourself in 6 months. You feel great. You've got tons of energy. Your brain has come back online. You've healed the relationships that have suffered through your illness. You are joyfully spending time with friends and family. Your career is taking off. Your anxiety and depression have melted away. Your financial future is secure again, and you sleep deeply and easily all the way through the night. The illness is a distant memory. So if you want this future for yourself, and if you're committed to it, I'm committed to it as well. And I invite you to join me in my live masterclass so that you can make this happen for yourself. So my mold treatment live masterclass is a step-by-step mold eradication protocol that I will walk you through in a spoon-fed way. It begins with accurate testing. As we've learned ad nauseum probably tonight. Remember how Lucy was diagnosed with a foot drop, and she was actually Lucy with the foot drop was diagnosed with a rare autoimmune disorder. Kathy was diagnosed with basilar migraines. My son Kai would probably still be under Lyme treatment if I didn't know about the mold in the house. Um, So again, I wanted whoever thinks they were misdiagnosed to put it in the chat, but you might have already done that. So my course is really designed to help you get your health and your life back and to keep it. So I want you to be able to live your best life. My goal is that we can create tolerance and resiliency to the world together. Once you've eradicated the mold in your system and you've decreased that total body burden, we can learn tolerance. You have more bandwidth with which to interact with the world. So you can get a mold exposure. My goal is that you could go on vacation or on a trip, stay in a moldy hotel or moldy Airbnb, maybe not feel great at the moment, but bounce back immediately. I want you to get to live your full life. I do not want people living in fear of mold. That is not my goal. My goal is not extreme avoidance. My goal is that you actually get a life back that is glorious and really worth living. So here's what it looks like. If you register now or tonight, you'll immediately get access. You'll get an email that has access to your client portal, which is your hub that has everything you need to succeed in the course. So you'll get the first 9 modules, you'll get a bunch of guides. There's an e-store, that has all the mold treatment things that you need with a discount for people in the course. And I'll just remind you that the first 5 people to register get their free one-on-one call with me. And so here's what the schedule looks like. So it's every Monday over the summer at 5 o'clock. And you don't have to be there for everyone. They're each week it'll be about 30 to 60 minutes of course content with a long Q&A. So I make sure that everybody, is successful in the course. And if you can't make these times and you're traveling over the summer, it doesn't matter at all. They'll all be recorded and sent to you right after the live module is done, and you can do them on your own time. So you can do them over coffee on a weekend. You can do them while you're cooking dinner. You can do them, when your kids go to bed, whenever it works for you. And so I also want you guys to know that I decided today that if you register tonight or within the next 24 hours, because this is my last free webinar, I'm going to do $1,000 off for all of those that can register tonight. So this course is for those of you who are ready to get better, those of you who are sick and tired of feeling crappy, and those of you who have tried but failed to eradicate your mold. So generally, when patients come to see me in clinic, they spend $15,000 to $25,000. My initial intake is about $1,400 alone, and my schedule is full, and I can only treat people who live in Colorado. And so out of this is why I created this live masterclass to be able to bring the mold eradication protocol that's curated and successful to the rest of the world. So if you register for the course in the next 24 hours, you'll get that $1,000 off. And you'll be part of the first and only live cohort of the course that I'm going to do. You'll have weekly Q&A with me, and you'll get immediate access to all the course materials. And this is where you get your life back. So I know these are big numbers. I know many of you have probably already spent, quite a bit of money trying to get well. So with the $1,000 discount that we're offering tonight, we also have payment plans. So there's a 3-month plan that's $1,400 a month, and a 4-month plan that is $1,100 a month. And then I also have some really fantastic discounts for teachers, people in the medical profession, and military personnel. If this applies to you, please email us, and we'll tell you about the discounts. So email info@drfoxmedicaldetective.com. So what do you need to bring to the table? I need you to bring hope. I need you to believe that you can get better. And I will need you to find a supportive physician to write a couple of prescriptions for you. Um, in the um, in the live masterclass, you'll get a comprehensive find your supportive physician guide that has thousands of options on it. And I really don't want you to worry about this part because I have several docs that have already agreed to do this with patients. So, if there's nobody on the list that you're enjoying, I have people that will do this for you. So, if you register, you'll get the first 9 modules that you'll do on your own time. And this sort of just gets you up to speed with all the concepts and the languaging, and it gets you right up to the part of testing. So you can get your test results done, the adequate tests, and have your results in hand to start treatment. So, and these first 9 modules, it's not a big commitment. It's a bit less than 1 hour to do the first 9 modules. And then you'll have, so I'm going to do the first, sorry, I did the first live module last Monday, which is treatment phase 1, bind and unwind, where we get to get moving on things. And I'm going to repeat that first module this Saturday at 3 o'clock. For those of you joining tonight that want to do that first module live. And I wanted to let you know that when you register and you get all the course materials, you're also going to get a biotoxin relief guide, which will teach you all the different modalities to help pull out and detoxify these mycotoxins. You'll get your comprehensive supportive physician guide. You'll get a course companion guide where you can take notes and refer back to, and this is, sort of the thing that you'll use throughout the course. You'll get a resource guide, which has everything you need to succeed, from the testing links, testing the home, testing the human, filters, treatment, everything that you need to succeed in the resource guide. So if you register now, you'll get your $1,000 off, and then you'll immediately get an email with access to your client portal that has everything you need to succeed in your mold eradication protocol. And I know it's so cheesy to say this, but really, what better time than now to begin feeling well again and build up your strength and rebuild your life and repair your relationships? So I hope that those of you who are ready to get at the root cause of your symptoms and get your awesome life back will join me on your healing journey. And I hope that all of you tonight at least feel a little bit of hope. You know that mold is real, is treatable, and it's not in your head. And I hope that you all know also that you're not alone on this journey. And like I said, many people here tonight likely have a shared experience. And I also forgot to mention there's a community support forum in the course where you'll be with other people that are mold sensitive, like myself, like most of you out there. Um, and for those of you who do resonate with this protocol and are ready to get moving and get your awesome life back, I'm so excited to see you on Saturday and Monday, or one or the other, whichever one works for you. So I'm going to pass it over to Aaron. He's my business partner who you've probably had some interaction with at this point. He does all the back end, and he's going to, hi, Aaron. He's going to show you a little bit about what the course looks like, where you would click into the support forum, where you find your guides, and then we're going to move into a Q&A with Amy. And after that, we will announce the winner of the full ride scholarship for the masterclass. All right, Aaron, I pass it off to you.
Perfect. Let me share my screen. And I know we're already running over, so I'm going to try and breeze through
Oh,
this
sorry.
one. Yeah,
I
really
blather
quick.
too much.
But it's always nice to have a visual aid. Nice to meet everyone. If you're getting messages from info at Dr. Fox Medical Detective, it's usually me. But we have a full team behind that email. So let me quickly share my screen because I know it's always helpful to have a visual aid. So once you log in, once you get into the website here, you'll see kind of all these different areas. So the e-store is available right here where you'll be prompted to log in. If you are looking to have the webinar registration and the webinar replay, you have access to that there. But just wanted to give you a quick visual aid of what the course looks like and kind of how it's built in the back end. So when you when you go into the first module, you'll see all of your resource guides here. They are sprinkled throughout the course, and we'll be including them in multiple sections. If you do sign up, we're also sending an email with them. So you really get these guides in multiple places, but we just want to make sure you have access to them. Our community page is listed here. So it's kind of like a private Facebook group. And then we also have the e-store here. So these are all linked directly from the drfoxmedicaldetective.com. But I will cut it there because that is all you need to hear from me.
Thank you, Aaron.
All right, are we ready to get started on the Q&A? We had a lot of questions.
Oh, Amy, can you give me any sense of like how many people said they have Lyme? How many
Yeah,
people said they have hope?
yep.
More or
So
less.
it looks like we had 8 folks who raised their hand for misdiagnosed, 5 folks for Lyme, and then 12 people for trash can diagnosis. It's a little more common as we expected. Yeah. One of the questions I had, Dr. Fox, that I thought was a good one, and I wasn't sure how to answer was for those folks who have been tested for mycotoxins, can the levels go up and down? Can they fluctuate?
Mm, yeah. So, I mean, if you're still in an exposure, they're probably going to go up. If you're doing binders and treatment, they're probably going to go down. I don't see them doing that randomly in the tests that I recommend. They tend to make sense.
There's another question. What happens if my test is negative?
You get a full refund if your test is negative.
Okay. And then just kind of piggybacking on that, what is the cost of testing?
About 300, 3 to 5, depending on which test and which provocation you do.
And that's just to clarify with folks too, that's not part of the cost of the course either. So just
No,
so people are
sorry.
aware.
And I
Um,
really tried to get discounts on the testing too, and they wouldn't.
um, so so this is a good question. What happens if I don't get better?
Um, if you don't get better, well, we'd have to like troubleshoot that a little bit. So are you still in a moldy place? Do we know that your place is clean? Have you done a post remediation qPCR ERMI? Or, do you have other diagnoses like Lyme and things, and now you've gotten the mold out of the way, but you still have to go on to, treating some other things?
And you also talk about in your course, Dr. Fox, just kind of like you said, addressing yeast and stuff like that too, and also going really slowly with the detox process. You kind of explain that bucket that folks, if they're going too quickly, they might not get better. So going slow in that process. Um, we had a couple people ask, we haven't had this question yet, but we had 2 people ask about heavy metals and how that falls into the protocol, or how do you treat that in relation to mycotoxins?
Yeah, sure. So heavy metals are part of that total body burden and your bucket filling. So if you have a high heavy metal load, that can even make it where you're more sensitive to mold because you don't have any bandwidth, right? Your bucket's already full. And it's actually pretty easy to add a chelation, a heavy metal chelation protocol into a mold protocol because all the surrounding detox stuff is very similar. So it's not so hard to add in a little heavy metal detox if your metals are high.
Okay. Um, okay. Oh, this is a good one. Can the course be adjusted for children?
I think the youngest I've been able to sort of treat successfully is probably 5 or 6. I mean, the one thing is you got to be careful with little ones. And then the second one is just, it's hard to get these things into them, so
Mhm.
you've got to like figure out ways to hide binders into something they'll eat and stuff like
Right.
that. But usually, 5 or 6 years old I've treated plenty of that age and
Okay.
older.
Okay. Let's see. I'm looking at questions as we're talking too, so I'm just trying to make
Sure.
sure we're kind of running out of time. But I think we have time for one more. Let me see what the so you kind of spoke to this already, Dr. Fox, but what if I have questions along the way? Will I have access to Dr. Fox? Can you kind of speak to that again?
Yeah, so if you have questions along the way, you email info@drfoxmedicaldetective.com. And you'll have a Q&A with me each week. And then there's also a community support forum that Amy will be monitoring, and another person that does mold on our team, Derek, might be monitoring, and I'll pop in there a little bit as well.
Okay. Perfect. Okay, so I think we're hitting our time. I'm sorry I didn't get to all the questions, but just a heads up to everyone, you will get a link in an email after the course to replay the webinar once we're done. And then you'll also have the opportunity to set up a discovery call with me. If you have additional questions, I can speak to you personally as well. So I think it's time to announce the winner of the full ride scholarship.
Oh, sure. Great. This is so fun. Shannon Vial,
Shannon,
Viall.
Shannon, if you're out there, if you pop onto the Q&A and let us know that you're here,
Or raise
we'll
your
give her,
hand. Either way.
or raise your hand. Hey, silence from Shannon.
You sure? Nothing? I almost moved on to the second person last time. And
But I know.
should I go ahead?
Shannon. Oh, she's here. She's here.
There's, yay. See,
Yeah,
I
sorry.
knew I shouldn't move too fast.
Yeah, yep. So Shannon, yep.
Oh,
You'll
great.
get more
Congratulations,
information.
Shannon.
Congratulations. And Erin, you'll be sending her more information once this is over, right?
Correct. Yeah, Shannon, I'll reach out to you directly. You're still gonna be getting some emails later tonight, but expect an email from me probably early tomorrow, and we can take it from there. Let's see here. All right. I think that's it.
Okay.
And
Well, thank you
So
all for
remember,
joining us tonight.
thank you for joining. And don't forget, you can email info@drfoxmedicaldetective.com too if you have any other questions, or sign up for that discovery call if you want to speak with me. And thank you so much for joining us. We'll see you hopefully on June 22nd for
Yep.
the first phase of the course.
Yeah. And again, just as a reminder, we have 5 slots remaining for meeting a complimentary one-on-one with Dr. Fox, and the $1,000 off is good until 24 hours from now. So about, we'll call it 9 p.m. Mountain time, or excuse me, Eastern time tomorrow.
Okay.
Great.
Well,
Thanks,
thank you,
everyone.
everyone.
Bye.